So it is the beginning of November, as I mentioned, and we're getting ready for our big Black Friday event. Obviously, on our website, we have over 75 different natural supplements to help your kids. We've got lab testing to help your kids. We're trying to expand our education in addition to this podcast with stuff on our website. So every Black Friday, we've got our big sale of the year. And so it's a great opportunity if you guys want to try anything, that's the time to do it. And as many of you know, Spectrum Awakening has a 30-day return policy. So if you get something, your kid doesn't like it, you change your mind, you can always send it back. So that's where our Black Friday event is a great time to try new things. So to prep you guys for that, we wanted to talk first about lab testing, okay? So when we say lab testing, we talk about all the different medical things that are going on inside your child, because it's important to remember autism is a medical condition. All right. It's not a behavior choice. It's not parenting. There are medical things behind it. And there's lots of scientific research. We're going to be going over some of that today. A lot of scientific research that shows the different medical things that are going on in autism that are not happening in our neurotypical kids. So I'm here to guide you today through the different testing that's available for your kids and how that can help you pick better treatments. And the goal of any lab test is to pick treatments, all right? So that's what we're going to dive into today. Now, let me say first, when I say lab testing, I want to talk about two general things. Number one, most of the time I say lab testing and many people think, oh, I got to go get my blood drawn. My kid and needles is a horrible show. Don't even think about it. And I get that, all right? There are so many ways we can collect testing samples that is not blood. All right. A lot of our tests are urine tests. A lot of our tests are poop tests. Some of our tests are saliva tests or cheek swabs. So I'm trying to give you guys the medical testing available that's not a blood draw. All right. So, and all of those are through our Spectrum Awakening website if you're interested. All right. Number two, the big general overall thing is that there are no medical tests that will diagnose autism. Okay. There are no medical ways to diagnose autism through a test of any sort, blood, urine, poop, whatever. That doesn't happen, okay? The only way to get a diagnosis is to get a neuropsych exam, get an evaluation, and that diagnosis is really based on observation and symptoms. Where the medical testing helps us is picking the right treatments for your child, because autism is a spectrum, as you well know, and kids are different, and medical things going on are different. There are some commonalities, which we'll talk about, but everybody's different, so there's different treatment protocols for everybody. And if it was simple and straightforward, we'd have figured that out by now. But there are definitely different categories of brain chemistry, gut infections, mitochondrial issues, toxic issues, etc. So let's go overall through the different labs, and I want to kind of show the science that we have. So first off, let me get my cheaters on. And the first test that we're going to talk about is, and we'll talk about a few. First test we're going to talk about is probably the most popular one. It's called an organic acid test. Now, this is abbreviated OAT, O-A-T, organic acid test. You may have heard about this. You may have done one for your child or more than one for your child. And it's probably the most popular test for our kids because it's so comprehensive, okay? So what an organic acid test is, it's a urine sample that looks at, a good 50 to 70 different metabolites or things going on in the body that look at our brain chemistry. They look at gut infections. They look at mitochondrial effect. They look at toxicity analysis. They look at some nutrients. So an organic acid test as a urine test is a nice broad spectrum place to start. So if you have done no testing for your child, I would say let's start there. Let's start with an organic acid test. All right. Again, simple urine sample looking at a lot of things. Brain chemistry, mitochondrial function, toxic analysis, gut infections, nutrient status, etc. Good overall kind of look. Let's see the science behind it. All right. Here's a research study that says organic acids as potential biomarkers for autism. Okay. Organic acid detection, all right, it represents an accurate strategy for diagnosis of autism and possible interventions. So again, it's as this study says, interventions. We're going to be able to find treatments through this organic acid test. Now, this research study also says diagnosis of autism. The diagnostic world isn't there yet, but hopefully it's on its way. Here's another research study that talks about an association between EEG abnormalities, levels of organic acids in children with autism, and levels of amino acids with autism. Okay. Now, EEG abnormalities, that's looking for seizure activity. Okay. So that's looking for electrical abnormalities in the brain, whether your child has seizures or not. Organic acids and amino acids can help you identify that. So what they found is that urinary levels of this organic acid here, this 3-methylglutaric, as well as this amino acid threonine, were found to be associated with the presence of seizure changes or epileptiform discharges, basically seizure activity, whether your child's having a physical seizure or not. These organic acids are associated with that. Okay. Now it also mentions amino acids. Amino acids are the building blocks of protein. So that's another test. It's a urine test that you can look at. I'll get to that more in a little bit. Here's another one talking about urine organic acids in children with altered gut microbiome in autism. Okay. The main variations of organic acids were detected in concentrations of something called p-cresol, then this other big word, which is abbreviated HPHPA, but we cannot confirm the presence of that as a biomarker of Clostridia overgrowth. So what does that all mean? That means that organic acids, this urine test you can do for your child, has alterations based on gut infections. Okay. And so they're highlighting a couple of these, this cresol and this other HPHPA, that are markers of gut infections. Some organic acid test companies associate these with clostridial infections like C. diff. This research study says it may not be Clostridia, but it still shows abnormalities in your microbiome, in your probiotics, in your gut infections. Okay. Next is, again, the differences of gut microbiome or your gut infections and correlations with urinary organic acids in autism. Autistic individuals had more prominent gastrointestinal disorders. We know this. The diversity of the gut microbiome was lower in the autistic group. That means they have less diversity in their good bacteria, their probiotics. All right. Among urinary organic acids, adipic acid, hydroxyglutaric, tartaric acid, homovinylic acid, hydroxyphenylacetic acid, aconitic acid, and hydroxyhippuric acid were elevated or richer in the autism group. All right. What do all those things mean? Basically, what that means is this organic acid test is going to be abnormal based on gut infections in our kids with autism. And like I said, that's one of the subsets of analysis in this OAT test: gut infections, brain chemistry, toxins, nutrients, mitochondria. All right. So it's a really important test to do. Okay. Let's keep going here. Got two more on the OAT test. Urinary organic acids test to assess nutritional individuality in autism and biochemical individuality. So significant differences were found in the autistic children compared to the control group in organic acids of oxyglutaric, isocitric, citric, hydroxybenzoic, hydroxyphenylacetic, hippuric, adipic, subaric. All right. And you don't need to know the details of all of those. What these research studies are describing, which is my point that I want to convey, is that you'll get abnormalities on the organic acid test in our kids on the spectrum that indicate something's going on, indicate a gut infection. All right. And neurotypical kids normally have normal organic acid results. So this is a way we can identify a treatment if we need to go after a gut infection, which is super, super common in our kids. All right. Last but not least for this category, I've mentioned briefly amino acids. That's protein testing. All right. And here's a study, urine amino acids in children with autism. Higher values for glutamine, hydroxyproline, tyrosine, aspartic acid, and tryptophan, and lower values for serine were noticed in the autism group versus the control group of neurotypical kids. So in addition to getting these abnormalities in organic acids, you'll also get these abnormalities in proteins or amino acids in our kids. And again, that guides treatment. So I brought up the amino acids and organic acids together to talk about the testing that's available. So there's three major ways you can test your organic acids and amino acids. Number one, you can do it through a regular lab. You can go to Quest, you can go to LabCorp, you can go to your hospital, get organic acid testing, get amino acid testing through the urine. All right. They don't do full-on comprehensive analysis. It's decent, but it's not complete. So if you want to get a really good, comprehensive, thorough organic acid test, you're going to use a specialty lab. The big ones out there are Genova and Mosaic Diagnostics. Now, Mosaic is the new name for Great Plains Lab, which you may be familiar with if you've been on this journey for a while. So Mosaic and Genova do these organic acid tests. There's slight differences between the two of them. The Mosaic organic acid test, the thing that they have that Genova doesn't, are different analytes for mold. Okay, so the Mosaic test, organic acid test, could look for some mold infections in you. We'll get to mold in a minute, but they don't have amino acids. When you use the OAT test from Genova, that does include amino acid testing in addition to the organic acid testing. So if you're interested in getting those, through our website or wherever, you know the difference. If you want to look at organic and amino acids, you can go with the Genova. If you just want the organic acids with this mold evaluation, you can go with Mosaic. They're both amazing tests, much more comprehensive than regular labs, Quest, LabCorp, hospital stuff. But those are your options. Okay, that's test number 1. Test number 2 is a stool test. All right, stool tests are probably the organic acid and stool tests, probably the top 2 tests that are done on our kids. So many of our kids have gut infections, okay? Bacterial infections, parasites, worms. I just was on with a patient today. We found C. diff infection. They can have C. diff, they can have E. coli, parasites, yeast, candida, mold. All this stuff grows in the intestines and the gut of our kids. Why our kids and not neurotypical kids? For some reason, there are suppressions of the gut immune system in our kids versus neurotypical kids. And it's the suppression of the immune system in the gut that allows these infections to grow. All right. So a stool test will look for that. You can get stool tests through regular labs, again, Quest, LabCorp, hospitals. They're not great. They're not very thorough. And they don't look for yeast. They don't look for fungal infections like candida or mold. So if you want that, again, you can use a specialty lab that really does a great analysis on infections, bacterial infections, parasites, viral infections, yeast infections, and they're also going to analyze the health of your gut. They're going to look at inflammation. They're going to look at digestion. They're going to look at something called short-chain fatty acids, which are your prebiotics, okay? So a really good stool test will do that. And again, we've got those really good stool tests on our website if you're interested. We have the one from Genova. We have the one from Mosaic. We also have one called GI Map. All great tests. Little secret of the industry. They were all developed by the same guy. So very similar technology, and they're just available through 3 different companies. Okay, let's get to the research on stool testing for our kids. All right, here's a test that says gastrointestinal flora, which is your probiotics, GI flora and gastrointestinal status in children with autism. Children with autism have a much lower level of prebiotics, those short-chain fatty acids. Children with autism have lower levels of this good bacteria probiotic, bifidobacter, and often higher levels of this probiotic lactobacillus. So you're not going to know what probiotics are in your child unless you test. Typical labs don't have that testing. Specialty labs have probiotic analysis. All right. Is that the only one? Shoot, that might be the only research study I have on stool tests. There's a lot more that talk about the microbiome and probiotics in autistic kids versus neurotypical. I didn't kind of want to hash around that same thing with multiple studies, but trust me, I see gut infections in easily 75% of our kids, period. All right. Next, and I see a lot of good questions coming through, so I'm going to get to those after we talk about our topic. So the next test that I think is really valuable is genetic testing. And I want to kind of go over the basics of genetic testing. We talk about genetic testing a lot on this podcast. I think it's incredibly essential for so many of our kids, because if we go back to the first question of, hey, my kid just got diagnosed with autism. Why? Why does my child have autism? It's a huge, fair question that we all need to ask. All right. I have found over the past 21 years, about a third of our kids have autism because they were born with a genetic issue. They were born with some gene not working. And that gene that's not working has to do with brain development. And so we see this in about a third of our kids. And the great thing is many of these genetic issues are treatable. Again, patient I just had this morning, different patient, we went over genetic testing with their child. They had 2 genetic mutations that can cause autism. All right. this family the mom has 3 kids, all with autism. All right. There is a genetic component in here. And luckily for that patient, those genetic issues were treatable. So we started treatment. Okay. So the goal of every test, again, is treatments. Now, while only 1/3 of our kids have genetic causes for autism, the other 2/3 do not. I find those 2/3 kids are the ones that have regressions. And, your kid seems typically developing till 12 to 18 months, and then bam, everything regressed and went away. Those kids are normally not genetic issues. However, you can have both. You can have a child with a genetic issue, then has a regression into autism. So it's possible. I've seen it. So you want to get genetic testing. Another broad thing to mention about genetic testing is there's a lot of genetic testing out there online, on the internet. And this has really exploded over the past 10 years. But there is differences in the genetic testing that you can order versus what a doctor can order. So if you've done genetic testing for things like MTHFR, companies like 23andMe, MaxGen, there's a lot of companies out there that are doing this testing. It's not the testing that is most beneficial, because that genomic testing, something you can order yourself online without a doctor's prescription, that's not going to identify genetic conditions. That's not going to identify genetic causes of autism. It's going to look at risk factors. And it's great because those genomic tests can create treatments, but it's not a diagnosis. For example, if your child has Down syndrome, they have a genetic condition, they were born with it. You do this genomic testing, again, this 23andMe, this MaxGen, it's not going to show it. It's not going to say, oh yeah, there's Down syndrome here. They're not looking for medical conditions. They're looking for our individuality. So if you want that genetic test, I find it very, very important for a lot of our kids. The 2 genetic tests that you want are called a microarray and an exome sequence. That's EXOME. Those are abbreviated CMA and WES. Okay, CMA, WES. You can get this kind of testing from your doctor. Okay, talk to them about it. Or you can get that testing through our website. With your doctor, it's probably going to be a blood draw. The genetic testing we have on our website is a cheek swab. So it's like a Q-tip, and you just get a bunch of saliva on it inside the cheek, send it into the lab. You will identify either there is a genetic condition for my child's delays, and here's a potential treatment, or you rule it out. The genetics are fine. You're great. I will also say this one other thing. Many doctors, conventional doctors, when they do genetic testing, do some of it. I mentioned 2, CMA and WES. Many of them will order that first part, CMA, or maybe some Fragile X testing. And they'll tell you, and this is what I hear from families, they'll tell you, oh, I did genetic testing and you're fine. Okay, that may be true, but all of the genetic testing wasn't done. All the genetic testing wasn't performed. What they did do may be normal, and that's great, but it's not comprehensive and it's not thorough. So you want both of those tests. And again, you can ask your doctor for that, CMA, WES, or you can get it from our website as a cheek swab. All right, let's get to the scientific research behind genetic testing. All right, here's a research study. Impact of genetic testing on patients with autism. A genetic evaluation should be offered to any patient who receives a diagnosis of autism. Let me just stop there, okay? Your pediatrician needs to know a genetic evaluation should be offered to any patient who receives a diagnosis of autism. I know many pediatricians who don't. They say, go to your therapy and go to your therapy. Bye-bye. Got to go. All right. Ample evidence exists that genetic testing has the power to change clinical management in many of these patients. Given the potential for clinically actionable results, it's important that genetic testing be available and accessible to all patients with autism. I could not agree more. And that's why we have these lab tests on our website. If your doctor isn't going to do this medical analysis for you, I want to provide a place where you can get it. Okay? So you can go onto our website and get these tests. I write the order. Again, the genetic testing, you can't get online, the diagnostic stuff. You get it on our website, I place the order, you get the real results. Here's another one. Oh, it's one of my favorite studies. This is from Harvard. Okay? Pathogenic yield of genetic testing in autism. 12 out of they tested, 299 kids. 36 of them had pathogenic findings. Those are like serious genetic findings. There were no differences in language or motor scores among children with normal genetics versus intense pathogenic genetics. Medical recommendations in response to the genetic findings were made for 72% of those with serious pathogenic results. Let me hammer home 3 points here. All right. A, this study said that 12% of kids have genetic issues causing autism. I think it's about a third, but definitely a good percentage. All right. There's no difference in severity. Hey, everybody. For those of you who are on live, just had a little connection issue. I'm not sure. Something happened with our Wi-Fi. It looks like more people are getting back on. So again, for those of you listening live, my apologies. There was a little Wi-Fi connection issue where I'm at, but looks like we are back on. So let me go back and start with this research study. There's three major importance of this research study. A good percentage of kids have abnormal genetic findings. This study says 12%. I feel it's about a third. Okay. There's no differences in cognition, language, or motor skills in those with genetic issues and those with not. So whether your child is mild or moderate or severe doesn't indicate whether it's genetic or not. And I feel a lot of doctors only do genetic testing if your child's severe. All right. It should be for everybody. And then finally, interventions, medical recommendations were made for 72% of those who had genetic results. Most doctors don't know that genetic issues can be treated. In fact, I was at the Talk of Autism conference in October a few weeks ago and was talking to a medical doctor in the autism world who has a child with autism. We talked about genetic testing and his response was, why do it? You can't do anything with the results. All right. That's the thought process that's been kind of educated to our physicians. And until genetic testing really ramped up the past 10, 15 years, genetic testing wasn't done a lot because there were no actions. But there are actions for many of these genetic issues. I found this study interesting and I want to show you because you may feel this way. Genetic testing experiences among parents of children with autism. Among parents whose children with autism were tested for genetics, 37% had negative experiences, mainly due to the lack of perceived benefits and unpleasant testing experiences with healthcare providers. All right. So again, I find that this is really common with my patients. They may get diagnosed, they may be given genetic testing, but then afterwards they get nothing. All right. And the geneticist says, hey, we found nothing, or yeah, we found something. Bye-bye. Most geneticists aren't trained to treat. They're trained to diagnose. So I get a lot of families who say, oh yeah, this was horrible. I did genetic testing, it was horrible. I got nothing out of it, and I will get those results and say, yeah, here we have actions. We have treatments. Okay. So you may have experienced that or not. So that's genetic testing. Let me go over one other test. Before I do, live shout out to Alexandra. Haven't seen you in a while. Alexandra's from Romania and one of our great moms out there in Europe. Hope things have been okay since I haven't heard from you in a while. The next test we're going to talk about and have research about is mold testing. Okay. You may have heard about mold testing. It's become more popular lately. Mold is a fungus. It's a fungal infection, just like yeast, just like candida. All right. And this mold can grow in our guts. It can grow in our intestines. The only way to find if you have mold is to test for mold. And there's a lot of research that shows those fungal infections, whether it's candida, whether it's another yeast, whether it's mold, really affects our brain function. So here's a couple studies, and then we'll kind of move on from the research. There is one of the major molds is called ochratoxin A. All right. Ochratoxin A as a possible factor triggering autism. Okay. We propose a possible gene-environment interaction triggering autism, explaining the epigenetic neurotoxic mechanism activated by the mold ochratoxin A in genetically predisposed children. Very straightforward, very simple. Can this mold trigger autism? Because that mold is neurotoxic. It's brain toxic. Can that trigger autism in some kids? All right, that's what the study says. The study's 8 years old. How many of your pediatricians are looking at this kind of stuff, saying, oh, you know what, there's research that this might be a cause. Maybe we should look into it. Maybe we should test you, okay? Last but not least, the role of mold toxins, called mycotoxins, the role of mycotoxins in autism. This mold toxin, ochratoxin A, which was in the other study, comparing the results of autistic patients with those of unrelated controls. A significant association was found for the ochratoxin A levels in autism. Recalling the male prevalence of autism, obviously it's 4-to-1 males to females with autism, ochratoxin A exerts its neurotoxicity, especially in males. And that has to do with some genetic issues. But again, the point being, mold infections, especially in our boys, can really trigger brain toxicity and neurotoxicity and be one of those factors that is either causing autism or sure making it worse. So how do we test for mold? It's a urine test. It's called a urine mycotoxin test. Again, really straightforward. You collect some urine and you send it to the lab. Does my child have mold? You can find it. And then we can get rid of it. We get rid of it like we get rid of any fungal infection. We kill it off. Just like if you have mold in your home, what are you going to do? You're going to scrape it out and you're going to clean it. Clean it and get rid of the mold. That's what we're going to do in our guts. So that's another test we've got on our Spectrum Awakening website that's got good research behind it on why you want to do it. So let's go back and review all those lab tests and then get to our live questions. Medical testing for autism is extremely important because it helps us understand what's going on medically in our kids and what treatments we can create from that. All right. There are no medical tests to diagnose autism, period. Does not exist. It's not confirmed by our science. People are trying to investigate things and that's great, but nothing's really been confirmed yet. Okay. But these tests are done to create treatments for your child. What tests do you want? All right. If you're new to the autism biomedical world, to the medical testing of autism, you're going to start with an organic acid test, an OAT test, which is a simple urine test, and or a stool test. If your kid has a lot of bowel issues, stinky poop, that kind of thing, you'll definitely want to do a stool test. Other tests you can do to consider, we talked about the genetic tests, which I think is an issue for a third of our kids. Side note, I did not show this scientific research this time. I've shown it in previous podcasts. Females with autism, 50% of them have genetic issues. That was a study from Yale a few years ago. So if you have a child who's a female with autism, definitely get genetic testing because it's 50-50 and could be treated. That study from Harvard that I showed, 70% of those with genetic abnormalities causing autism have medical treatments, period. Okay. I create these for my patients all the time. All right. If you do get testing from our website through Spectrum Awakening, you're going to get a copy of your results. You're going to get a copy of a medical interpretation, a written interpretation that I put together. I look at your lab tests. I give you instructions on what it means, what you're going to do about it. All right. We also have the mold test out there. We also have other tests available on our website, which we didn't talk about yet. Things like food sensitivity testing, things like toxicity analysis through porphyrins or heavy metals in the hair. We have glyphosate analysis. That's the Roundup pesticide. I think we have another one I forgot. But go to our website, spectrumawakening.com. Click the button that says lab tests right at the top. You'll see all the ones that are available. If any of those are interested to you, you're going to get medical recommendations on how to help your child. Okay, so let's get to the live questions. Before we do, coupon of the weekend. Coupon of the weekend is Lab 20. Lab 20 is going to get you 20% off any of the lab tests, any of the supplements on our website, spectrumawakening.com. That expires November 10th, 2024. If you want one-on-one help, I have a telemedicine practice. I talk to patients all over the world. You can book your appointment on our website. So that's what you can do if you want that one-on-one help. I think we've got 4 appointments left in December. We're booked for November, 4 left in December, and then we're looking into the new year. All right, so let's get to our live questions. I should put on my cheaters for that. All right, live questions. We've got Jasmine on. Live shout out to Jasmine. I hope Charlie's doing better. Know we had a little flare. Gotta said, hey doctor, which is the best, DMG or TMG? So DMG and TMG were really popular a while ago, like 20 years ago. They are different forms of a protein called glycine, and it's used as a methyl donor. So if you have problems with methylation, the DMG or TMG can help. I find DMG seems to work better in our kids. Some of my patients say no, TMG works better. So I think it's kind of a trial and error thing. But I would go with the DMG. It doesn't work for all. I think it's kind of been phasing out of autism biomedical treatments just because the benefits aren't as good as other things. So, but you never know till you try. Sandra, I had a urine test done for my son from a functional medicine doc. I was wondering if you could take a look at the results and give me your opinion on how to treat. Sandra, I would love to do that. I do that with a lot of my patients. So set up a telemedicine visit and you can upload and share all those lab results. Okay. And so we can go over all of those with a fine-tooth comb. I can tell you exactly what's going on, what your doctor may have agreed with, what your doctor may have missed. And trust me, I see a lot of testing that's done and results ignored. And that kind of frustrates me because this organic acid test or other tests are so comprehensive. There's so much there. I see a lot of people going after certain things like gut infections. Great, very popular, but missing other things, mitochondrial support, brain chemistry balancing, that kind of thing. So yeah, if you want to set up an appointment, Sandra, send me all your labs, through our medical portal. We can look at everything and I'll give you a whole new treatment plan. Lee says, little help, Dr. Skowron. Your order's some for my child, but I couldn't find them on our website. Can you send it to my email? Yeah, Lee. So Lee is a patient, just had an appointment a couple weeks ago. Lee, what I want you to do is contact our office and tell them, contact our office and tell them that, and our front desk staff will take care of that for you. If you've forgotten the email, you can go to our website, spectrumawakening.com, go to appointments, and the email and the phone number are there. So you don't have to set up a new appointment. Just contact our office and we'll take care of it. All right. Next, we've got live shout out to Colleen. Hey, Colleen. Nah, I just got our Power and Focus for my son. Is there any food we need to stay away from while taking it? No, you can take it with any foods. Mix it in food if it helps them get it down. I prefer the morning for that just because I don't want it to affect their sleep, but that's when I would start. Live shout out to Diane. Angie, my daughter's 15. She's low in iron. What do you recommend? Well, a couple things. Either just iron in your diet. Beef is the best source of iron, whether that's burgers or steak, meatballs, that kind of thing. You want to go with beef. If not, start an iron supplement. Okay, you don't need much, like 20 milligrams a day. You can take it as a capsule. There's liquids, there's gummies, there are all sorts of form. Get on about 20 milligrams of iron a day. This is going to get worse in those who have heavy periods. Okay, so if you're a female, you've got a teenage daughter or older than that, and they have their cycle, if you lose a lot of blood, you're losing your iron. So iron's really important for every female who still has their cycle because you're constantly losing blood. Angie, I'm doing your yeast protocol. What can I do for anxiety? Well, let me say this. If the anxiety increased with the yeast protocol, add more binders. Okay? This could be a die-off reaction. More binders is the way to get through that. If your child still has anxiety and it's not a reaction to the yeast treatment, then you may want to try our serotonin supplement, which currently is on back order. Or we have we have a couple. We have something called Common Cool. We have a chewable GABA. We have a chewable theanine. We also have an herbal supplement, which I like, called Spectrum Tranquility. I would look at those things. Diane, Doc, my son gains so much on a homeopathic detox, and a new protocol is making him regress. Is that normal? No, I don't want any regressions. So I would talk to your homeopath and tell them that and say, no, this is the wrong direction. And again, I like homeopathy. We used to have homeopathics on our website, which were amazing. Unfortunately, we no longer have them. The company that gave them to us kind of blacklisted us because we were selling so many. They were getting attention from the FDA. So it's great. Homeopathy can work, but I don't want to see any regressions in anything. Brianna, what test should be ran if a child's sound sensitivity has increased? I find that is a reaction of inflammation. So I would start anti-inflammatories. Obviously, we do not use Tylenol, but if you want to try some ibuprofen, you want to try some of our curcumes or our Panda Bear, that inflammation really affects sensory issues. Also, when is the best time to use glutathione cream? I like it before bed, but any time is fine. Sandra, I have a friend looking for a genetic test. Her pediatrician doesn't do it, she said. Can she get it done through you and have her insurance cover it? So the first comment you made, the pediatrician does not do genetic testing. That's fine, okay? Pediatricians are not trained geneticists, but they should give you a referral. They should say, I don't do this. Here's a geneticist. Here's a neurologist. Here's somebody that will do that testing for you, okay? Can she get it done through our website and have insurance cover it? Unfortunately not. We do not do any insurance processing for the labs on our website, so it's just straight up, but it's available. So I would have her go back to her doctor. If she wants insurance, have her go back to her doctor and say, yeah, I want genetic testing. Refer me to somebody. Denissa says hi. Hi, Denissa. Good to see you guys. Michelle, what biomarkers do they look at to the OAT test? There's so many. I mean, you're looking at 70 plus different biomedical markers on an OAT test. If you want to know exactly, I would go to our website, and we've got example results. So you can see every single organic, every single thing that's being tested on there. Audrey, what can I give my son to remove yeast from the gut? Well, Audrey, if you haven't tried our yeast mold bundle, I would do that. And our yeast mold bundle are 3 products that are used together to dissolve the biofilm of the fungus, kill it off, and then bind it and grab it out so you don't have many die-off reactions. Try our yeast mold bundle, Audrey. All right, Diane, my son had Cresol. It was terrible. Thank you for your gut reset probiotic and your advice to keep using natural herbs. We'll do another OAT test next year. That's awesome, Diane. Diane did an OAT test, found abnormalities that indicated gut infections, did some of our treatments, and is doing good. And we'll do another test. Okay. I see somebody just ordered some genetics. You will love it. Megan, how long does it take to get relief from a strep gut infection if using colloidal silver and grapefruit seed extract with binders? I would say a couple months. What you're going to do is do the treatment for a couple months, stop, and see how your child responds. If your child's, improves on the treatment and stays good after you've stopped it, you're done. If you improve on the treatment, stop the treatment and get worse, you probably need to do another round. Or just do another stool test. Sina, can I give my child Saccharomyces if she's constipated? So Saccharomyces boulardii is a special type of probiotic yeast, okay? There's good bacteria, bad bacteria. There's probiotics, there's strep infections. There's good yeast, there's bad yeast. There's candida, and there's beneficial yeast. Saccharomyces boulardii is a beneficial yeast. We've got that as a probiotic on our website. It's available over the counter. Could it help with constipation? Possibly. Live shout out to Rodney. Rodney, I missed you last week. Diane, my son's amino acids were very low and he was crying all the time. And after I gave him the amino acids, he's been very happy. This is great, Diane. First off, I love when our kids improve. So thank you for sharing that. Let me expound on that. You did amino acid testing. They were all low. You gave him amino acids. You gave him protein and he's happy because chemicals in the brain that make us happy, serotonin, dopamine, things like that, they're made of protein. All right. Without protein, you're going to be anxious and depressed, period. Okay. There's a research study I found years ago, like 10 plus years ago, which was really interesting. There was an animal study and they gave certain animals a full diet with full proteins. Then the other animals, the test group, they gave all the amino acids, all the protein except tryptophan. Now, tryptophan, that's that stuff in turkey that makes you calm, happy, and relaxed. Why? Tryptophan makes serotonin. So the animals without serotonin were massively anxious, massively depressed, couldn't run the mazes. It was a huge difference because we changed their diet. We didn't give them what they needed. Really interesting stuff. Natalia says, do they accept insurance? So again, the labs through our website do not accept insurance. If you can get your doctor to order this stuff and get insurance to cover it, great, go for it. All right, Brianna, what testing do you think is best to identify a gallbladder issue in a nonverbal child? Frankly, I would look at, there's some blood testing that can look at that. Talk to your doctor about it. It's pretty common testing, and an ultrasound. So I would, do a gallbladder ultrasound in combination with these very typical blood tests. That'll look it up. Lisa, what supplements can be used for the ANK3 gene mutation? Lisa, good question. I don't know that offhand. But Lisa, what I'd like you to, Lisa. Hi, Lisa. Haven't talked to you in a while. Do we have a copy of that? Lisa, I want you to, Lisa's been a patient for a long time. You contact our office and ask that, and that'll get to me, and I want to make sure I have a copy of those results. I just don't remember offhand. But get us a copy of those results. If we don't have it, contact our office. I'll get the message and I'll email you. Megan, you did a reel this week about Sac boulardii. How long of an application of this will begin to start helping the inflammation, improving behavior? Probably a couple weeks. If you don't get the improvement after a couple weeks, I would do like a full-on yeast mold bundle. Go with that. Christina, I got the LabCorp stool and urine testing and don't think it has everything on them. I don't see the yeast and mold results. I have a follow-up appointment with you in a month and I'm worried I'm missing important info. So that's a great question, Christina, and I'm glad you brought it up. It shows the differences between standard labs and specialty labs. So the standard labs, that stool test, is a decent stool test for bacteria, viruses, and parasites. It's not going to look for yeast. It just doesn't do it. But there are urine markers in the organic acids and other urine markers that will get in that testing. That'll help us identify yeast infections. So we can do it with typical labs. We just got to put it all together. But these specialty labs, which you have to pay for, I mean, you get what you pay for, really, are going to highlight those. But don't worry. You're a patient. The stool and the urine testing combined will help us identify that. All right, Diane, why don't you have a butyrate supplement? Good question, Diane. Two answers. A, we used to. B, we don't anymore for two reasons. Number one, it tastes absolutely horrible. I had a patient nickname our butyrate supplement the stank because it literally, you could have a closed bottle and smell it on your hands as soon as you touch the bottle. It was pretty gross. A better way to improve butyrate is with prebiotics. Prebiotics are going to make your probiotics make butyrate. So I'd rather give a prebiotic like our Prebiotic Supreme or increase dietary fiber. You're going to make way more butyrate in your gut with that than with a supplement. So that's why we don't have it. Susan, what types of things would suggest the need for oat testing? You have a child with autism, okay? You've got behavioral issues. You've got language issues. You've got motor issues. Any of that. It's such a good first level test. Sana, my 5-year-old has been taking the yeast mold bundle along with some detox, ALA and DMSA for the last 3 months. Notice she started touching her privates a lot. What could be the reason? Shouldn't the yeast mold supplement help with it? It should. We may have to switch up what we're doing. Try our yeast mold bundle with a colloidal silver. Since you're doing the grapefruit seed extract, we just may want to switch it up. Try that. Michelle, I recommended the oat test from Dr. Jared. Thank you on interpreting ours. We're at the 2-month mark of inflammation and aluminum detox. We've added some silica-rich water as well. Awesome, Michelle. I'm glad this stuff is working for you. I'm glad you did the test. I love interpreting this stuff because I've got this anger inside me when I see my patients could have better treatments from a test they've already gotten. Okay, so if you had a test done with something by somebody else and they've ignored something, I want to find that for you. I find it very personally satisfying that I can get this to you. So you're welcome. Zulika's off and on. Doc, my son's been taking Panda Bear. How long can I give him Panda Bear? He gets constant ear infections. I have him on antibiotics. Do this. Give the Panda Bear when he's not sick. When he is sick, I would take a break. So you can do this pulsing off and on. All right, let's see. Megan, my son had a huge spike in speech after using the Skowron solution. Yay! For those of you who don't know, Skowron solution is our 4-supplement bundle that helps balance brain chemistry and supports language. I tried adding more folinic acid. Doesn't seem to have the same impact. Would I get more consistent speech with leucovorin? Would a frat test be the best way? What's the benefit of doing the frat test if I already know he does better on folinic than methylfolate? So let me answer that last question. I don't think a frat test is going to give you any additional information besides go on folinic acid. Would leucovorin help better? You don't know until you try. Sometimes yes, sometimes no. So that's just kind of a trial error kind of thing. We may need to do something different, Megan, like detox to get that extra boost in language. But I'm glad you've had a boost with the Skowron solution. Look into detox. If you can get a leucovorin prescription, worth a try. But again, you never know unless you try. Jeannie, my daughter, through our gastro, has had stool testing. I call them to find out how extensive, what specifically should I ask for? Again, what infections are tested? That's what we're really looking at with this stuff. What bacteria does it test? What parasites does it test? What fungal markers, yeast markers does it test? That's what you're going to ask. All right, Natalie, do you have experience with a company called the DNA Company? No, I have not. I think you're going to be able to tell the difference if you can order this online yourself without a doctor's note, it's not diagnostic, okay? If you need a doctor's note to order it, it might be diagnostic. I'm just not familiar with that. The bigger genetic companies out there, we use a company called Centogene. There's also Gene DX. There's also Variantix. There's also Ambry. Those are kind of the big genetic hitters out there for diagnostic genetics for our kids. Sandra, my son found out that he has next to no vitamin C in the body, probably on the O test. We started him on a powder and started very slow, and he's laughing at nothing and shredding paper. Can vitamin C cause that kind of reaction? Sounds like it is. It might be due to some die-off reactions. You may want to add a binder. It might be due to the source of the vitamin C. A lot of vitamin C comes from corn. So if you have a corn reaction, it might be that. But you may just want to go after gut infections and a binder. Michelle, do you diagnose through telehealth? Michelle, I am not a diagnostician. I am your treatment guide. Okay? So we do not diagnose autism, but we will help your child and create treatments whether they have a diagnosis or not. We'll order the lab test. We'll interpret it for you. We'll put you on a treatment plan. We're here to help your child improve. We do not diagnose. Well, I am not a developmental pediatrician. All right. Alexandra says, nani? I don't know what that means, but it sounds good. Sandra, can mold trigger PANS? Yes. So what does that mean? Okay. There's a condition called PANS or PANDAS, very similar, that is an autoimmune attack on the brain caused by an infection. A lot of people are familiar with PANDAS. PANDAS is this autoimmune attack in the brain after a strep infection. PANS is the same exact thing, but not from strep. So you get an infection and you start getting brain inflammation. You can get it from mold. You can get it from viruses. I just had to talk to a patient this morning, got it from COVID. So yes, you can get a PANDAS reaction, I think, from many infections, even Lyme and tick infections. So mold, sure. All right, Diane, I'm so frustrated with the detox process. Nothing that works fast out there. Please create a good detox product. My son has barium, aluminum, mercury, antimony, thallium, tin, and lead. Yeah, I agree, Diane. We do have a few detox supplements. We have a fulvic acid, which is very high potency. We've got alpha-lipoic acid, which is great, and glutathione, which is great. We don't have any combo product. I've been talking to my producer about that, and last year we were in formulation with something, but it kind of fell off the radar. So let me get back in touch, because we do need something really good. Santa, how long after taking the yeast mold supplement should we retest? I'd say 3 months. 3 months is good. Michelle, I'm pretty convinced that aluminum is the cause of her son's issues, Eli's issues. I agree. It's time for a tetanus booster. I'm thinking about holding off on it. How do you feel? I feel that we all had a lot fewer shots than our kids do. How many did I have? 8? 10 maybe? I don't even know. But now our kids are signed up to get 50 to 60. And I don't think they need them all. Why did I only need 8? Most of us only needed a handful, and our kids need 50, right? I think the best way to go through this is to test for your immunity to tetanus. Okay, there are blood tests that will analyze that. They'll analyze the response to any vaccine. Say, hey, did this vaccine work? You can get a blood test to confirm it. Say, yeah, you know what? That vaccine worked. There's no logical reason I need another. All right? Will the doctor go along with that? I don't know, because, there's financial incentives that pediatricians vaccinate. They get money from insurance companies to use all the vaccines. So, but from a medical, logical, science standpoint, not dogma, okay, not protocol, you get the testing done for tetanus. If you're not immune, maybe a booster will help, all right? But if you are immune, it's not necessary from a medical, logical standpoint. But again, logic isn't used all that often. TJ, hey doc, I started Common Cool plus the Skowron solution. I didn't notice any negative effects or progress in his behavior, tantrums, vocal stimming, communication. What next? Go with gut infections. Try our yeast mold bundle, TJ. All right, Danny, what can cause gut motility to slow down? Lots of stuff. That's a great question. Mitochondrial problems. Mitochondria produce energy, okay, to move muscles. The gut is a muscle, pushes that poop through. Infections and stress. So those are the things that can do it. You know what one of my favorite things is for gut motility is castor oil. All right. Now look, our grandparents used to take castor oil orally for constipation. They'd blow out. Don't do that. Don't take it orally. All right. Get a little bit of castor oil, rub it on your child's belly clockwise every day, okay? Like maybe a tablespoon, just enough to get on there. You don't want to drip it off or anything. We used to have castor oil on my daughter's diaper changing table when she was young. I wanted to make sure she pooped every day. If she skipped a day of pooping, took some castor oil, rubbed it on her belly. Here it comes. Haifa, which test do you recommend to start out with? 4-year-old twins, diagnosed autism with a genetic variant. Well, first off, Haifa, we need to see what that genetic variant is. Okay, that might have a treatment. Number two, what test to start with? Again, the oat test and the stool test are probably the two most popular. Start there. Selma, what are your thoughts on red light therapy for our kids? I haven't, and again, that red light is supposed to encourage mitochondrial function. I've never seen it do huge things for my patients. Not saying it won't for your child. I just haven't seen anything, and my patients haven't told me any benefits. Gata, are all these supplements can't help child with genetic disorder? He needs another intervention. They can help. They can help because they're going to support healthy function of the body. When we have a kid who has a genetic condition versus a child who does not have a genetic condition, I think our ceiling of improvement is different. Okay, I feel that kids who do not have genetic conditions and have regressive into autism have full potential for full recovery. If you have a genetic condition, we may have a ceiling of how much we can improve, but they may have medical issues on top of that. Okay, again, as an example, let's take Down syndrome. If you're born with Down syndrome, you have Down syndrome, right? You can have medical issues that affect you and you're not at your full potential. We can help that up to that full potential, whatever that may be. But the genetics may also have another treatment intervention on top. Michelle, we need a new doc. Ours bluntly said she just feels some kids are just going to have autism. Well, yeah, but that sure doesn't help, does it? That sure sounds pretty pessimistic. That, yeah, some kids will have autism and then good luck. Don't let the door hit your ass on the way out. That's what I hear from your doctor. Yeah, you need a new one that cares. Let's start there. Let's just start with this caring. Oh, you know what, guys? Hold on. This is a total side comment. I want to make sure I can say this on Facebook. If this interests you, I just got a link to a podcast. I'm going to put it on our Facebook page. I got a link to a podcast with Del Bigtree. Many of you may be familiar with Del Bigtree. Maybe you've already listened to this podcast. It was a group of doctors that analyzed the Pfizer research on the shot that came out a few years ago and what they knew of side effects and didn't tell the public, what the government knew of side effects and still decided to, make this mandated. Blow your mind. I'm going to post that somewhere on our social media so you guys can take a look if you're interested. All right, tangent off. Selma, what natural supplement do you recommend for when our kids get sick? I love our colloidal silver. I always have some at my house. Gave some to my daughter this morning. She woke up, she's like, my throat hurts. I gave her some honey lemon tea, and I gave her some colloidal silver. Hour later, she's like, I'm ready for school. I'm good. Vitamin D is good. Elderberry is good. We got a really good elderberry gummy if your kids like gummies. Elderberry, vitamin D, vitamin C, colloidal silver. Great stuff. Adiomi, I just got Panda Bear. I'm currently giving my 5-year-old glutathione, omegas, and black seed oil. Can I use the Panda Bear? Yeah, sure. That's anti-inflammatory. Go for it. Misty, my son just had very high rubidium in a heavy metals test. How do I get rid of this from the body? Well, try our detox supplement, ALA, fulvic acid, and glutathione. If you go into our website, Spectrum Awakening, and go to products, there's categories. You can click the category that says detox, and they'll be there. Yes, Yelan, is alpha ketogluteric acid supplementation necessary if alpha ketoglutarate is 0 on the Nutraval oat test? It could help for sure. I believe we have some in our mitochondrial supplement, Mitomax. I'll have to double check, but it can help. It'll help mitochondrial function. Jasmine, when is your book coming out? Oh, Jasmine, thank you for asking. I need some encouragement. I with this kind of stuff, it ebbs and flows on, hey, how much time do I have and get it done and not. No date soon, Jasmine, but the writing has started. The writing has started, and I've actually already written out all of our patient stories. So about 10 families were willing to share, and thank you guys, I love it, willing to share their story about their child, like Jasmine and Charlie. And those are all written out. I'm working on the, more of the meat of the science of the book. We're getting there. We're getting there, Jasmine. I hope next year. Danissa, what's the best time to give Allergon? I would say a couple times a day. Does it make you sleepy? It shouldn't. It should not make you sleepy. Everybody's different, but it shouldn't. Oh, Philomena's on. Philomena, how you guys doing? Wonderful family from France. Here in the U.S. now. Hope you guys are doing well. Hope the grandchild must be like 2 or 3 now. And you have another one on the way? Well, I hope you guys are well. Zulika, my son is autoimmune. What supplements do you recommend since I'm doing Panda Bear, immune mushroom, and folinic acid? I would start to use, consider some curcumin, like our curcumies, and consider some of our antimicrobials, like our grapefruit seed extract, colloidal silver. If he can swallow pills, things like our biocillin, Paraslayer, go with that. Karen, my son just graduated from speech therapy. Healing can happen. Karen, that's awesome. These are the stories we need to share, guys. Karen's son just graduated from speech therapy. Healing can happen. This is what I'm talking about. And this is the hope, guys, that we need to share with others. All right. I'll do these. I've been doing these podcasts. I think we're coming up on 6 years now. I love guiding you guys onto what you need. But there's so many parents out there who don't think they can do anything because they're pediatricians. Like somebody just said, was like, yeah, some kids get autism. Bye. Okay. That's not the optimism and hope that we need. I need you guys to spread that hope. All right. I'll keep guiding. I'll keep educating. I'll keep trying to produce these things that help our kids. But you guys spread the word. Gielan, which Sac Boulardii strain is in your supplement? I think I don't know. I'm not sure if there are different strains. If there are, I'm just not familiar. But I would look at dose. Okay. So there's a product you mentioned, Floristore, which has been around decades. That was around when I was in med school. Check dose because dose matters. Bella, good morning from Carl. Bella's always on. Your multivitamin has been, so let me just pause there. We launched our brand new multivitamin, Multispectrum Complete. It's got 33 different ingredients, all the right vitamins, all the right minerals, all the right cofactors, and all the right forms for your kids in a powder, gluten-free, dairy-free, soy-free, non-GMO. And we just launched it last month at our TACA conference. It has been amazing since TACA weekend. My 15-year-old's behaviors at school are gone. Behaviors are gone. I know the vitamin has Bs, which it needs. Does my 15-year-old daughter need more? You never know till you try. You can add on a B complex and see the response. Also, thoughts on charcoal? I like it. Please open an office here in Orange County. See you next October. We want you on the panel. So 2 things. I love coming out to TACA, to be with you guys and talk to you guys. It's one of the highlights of my year. My sister lives out in Orange County. So maybe I need to come out there a few times a year. But you also said that you want me on the physicians panel. Tell TACA, email TACA, say we want Skowron back on the physicians panel because I want to be on the physicians panel. All right, Natalie, if I can get a functional medicine doc to order the genetic test via insurance and send it to you to interpret and provide a treatment plan, yes, we will do that with all of our patients. Okay. So, you get those test results, upload them to our medical portal, which you'll get access to as a patient. I will look through that and explain it all for you completely. And any of your tests, you got stool, you got blood work, you got whatever. We go through all that stuff with patients, every single test. Patient today, talking a lot about patients today. Patient today uploaded like 15 tests. We went through every single one, everything. Diane, phosphoethanolamine is low on amino acids. Am I giving my son PC? Is that okay? Yes, it is. Haifa, what testing do you recommend to start off? 4-year-old twins diagnosed with autism with a genetic variant of Nerexin 2. Those Nerexin genes, are pretty, Nerexin? Those genes are pretty common in our kids. So for testing to start off, organic acid test, stool test. All right, Diane, I'm giving my son ATP for his oral and fine motors. Do you think this is enough? You may need more mitochondrial support like our Mitomax, which includes ATP and carnitine and CoQ10 and NADH and PQQ, a lot of great stuff. Jeannie, on the Skowron solution, can we up the doses? Yes, you can. One thing at a time. A lot of great questions, guys. We're kind of running out of time, so I'm going to just answer a few more questions. Megan, the yeast mold bundle, do you give it all at the same time? Yes, twice a day. Lydia, dosage for NAC per day. You cannot max out on NAC. Okay. Most capsules are like 600 milligrams, like ours is, but there are IV NAC treatments of 15,000 milligrams. You know what it's used for? Tylenol poisoning. NAC is the antidote for Tylenol poisoning. In fact, there's a new IV medication that includes Tylenol and NAC. So it includes the antidote with the medicine. Why would you do that to a child? I don't get it. So Lydia, the more the better. Zulika, can I give mitochondria even if he doesn't have it? Yes. Natasha, what's the name of the bundle that helps with speech? The Skowron solution. Ingrid, Doc, my son's constantly antibiotics for his recurring ear, throat, and sinus infections. Keep being told that allergy medications doesn't seem to work. You want to take his tonsils out, okay? Take his tonsils and adenoids out. I would say 80% of our kids, that's going to stop that, okay? I don't think there's a supplement that is going to stop those reoccurring infections. Take the tonsils and adenoids out. It has helped 95% of my patients that have done it. All right, guys, couple last questions. I love your live questions. Travis, hey, Doc, we've been using Common Cool for 2 years. It's really good, helping your hyperactivity. Just wanted to say thanks for all you do. Travis, you're welcome. I'm going to end on that. Let's end on a high note. But again, I love that you guys share your stories of what works and what helps, because this is the hope we need to pass on to other families. All right. There are things you can do to help your child with autism, to help their behavior, to help their speech, to help their gut infections, to help their motor and their sensory. There's so much out there. How do you know what to do? Well, there's two choices. Number one, try something. Okay. Again, we've got over 75 different supplements on our website. If you're new to Spectrum Awakening, don't know where to start, we have a couple free ebooks. Download our free ebooks, take a look at them. That may help guide you. If you're interested in testing, start with some testing. What would you start with? Again, organic acid testing and stool testing are extremely popular and common because they're extremely helpful. But I would also encourage genetic testing. There's other things like heavy metal and toxin analysis, mold testing, food sensitivity analysis, lots of stuff out there. So if you want to try anything, okay, don't forget to use our coupons. The coupon of the weekend is Lab20. Use Lab20 to get 20% off any of our supplements, any of our lab tests on SpectrumAwakening.com. That expires November 10th, 2024. And of course, this end of November, Black Friday, we've got our 25% sale that we do every Black Friday. So that's when you want to get this stuff. Do it then. But again, there are things that you can do. That's the message.